Welcome, my name is Mark McLaren and I'm a member of the Art of Work team. Thank you for taking the time to watch this upcoming webinar where we're going to look at COVID-19 and how organisations can be better prepared to meet the operational and wellbeing challenges. There are a number of professionals who will offer advice and consideration throughout the webinar, and you're very welcome to contact us afterwards, either by email or phone. I hope you find this helpful. Thank you.
And welcome everyone to our webinar on COVID-19. Firstly, we've had extraordinary response to this event. There's probably around about 600 participants on this webinar today. I'm Kelvin Gann from the Art of Work, and I'll be shortly introducing you to our panel and take you through our discussion today. Now I'm just now going to switch into our presentation mode, so I'll do that now and we'll commence the webinar at this point. Okay, you should now be seeing the screen where we'll be presenting from for this discussion today. And again, welcome. Firstly, just I think it's become a really significant issue for both the community and for businesses, and it's affecting our life in every way. The impact of COVID-19, it can simply be evidenced by the anxiety that sits out there in the community at this point of time. This is simply a visit to the supermarket last night, and I think we're seeing this right across the country. The fact that our shelves have been emptied, I think, are a clear metric about the level of anxiety and concern that sits out there. So we wanted to engage in a conversation and see how we as a group of professionals in our roles of trying to lead and support our businesses and organisations to try and chart a way forward, which gives some people some certainty and clarity about how to successfully manage and transition to a future state condition for COVID-19. Just to briefly introduce our panel today, we've got Dr. Sue Rachi, who is an emergency physician with over 30 years experience in emergency medicine in the New South Wales health system. We'll be joined from Clyde & Co by Carrie Jarvis, who is a special counsel with significant expertise in employment and industrial law. Myself, I'm representing Art of Work, and I've had over 35 years experience in occupational hazard management and disaster risk management, both in the military and civilian context with a range of different organisations. We've got Mark McLaren joining us as the Managing Director of Generative HSE, and again, Mark has over 35 years experience from the organisational psychology context. And Sophia Newton is joining us. His expertise is in biomedical science around medical microbiology, immunology, and the molecular basis of disease. We were keen to put together a panel that had a range of different insights, so that firstly we could link and share our discussion with the evidence and combine that with some of the strategies and thinking that will help us navigate this process. We're also very grateful for the support and engagement for the Australian Institute of Health and Safety, who've been the professional body for the safety profession in this country. And I think really central to being able to join the community of safety professionals together, and particularly in this time to enable a connected conversation where we can bring our connected thoughts, ideas and strategies together. So again, very grateful for the Institute in the support of the discussion today. Just to frame up this conversation, what we're trying to do is put an extended lens around this particular problem. If we're going to address the anxiety that's dominating the community and also our business leaders and the government, I think it's really important to focusing on the well-being of the people in our respective organisations, and that's in a holistic sense. And that well-being is not just in the context of the immediate health of them, that's a really important part of the process, but also thinking in the broader context, how we're going to deal with the well-being concerns people have, both for what they're going to be doing from a work context, making sure that they feel secure, both from a community and work prospect, and that people's families are feeling secure. So we think it's really important to extend the lens to enable us to think more broadly about how to address this. In shaping this thinking, really what we want to employ is engaging the people of our organisations as being a solution to harness, and I'll address that a little bit later, because we can't underestimate the power that the insights that our people have to bring to this discussion. We also want to introduce and talk about some of the concepts around facilitating risk-based decisions and making decisions that drives both the operational well-being for the organisation and people's well-being. It's really important that our organisations are able to successfully navigate these really difficult circumstances to enable the future well-being of our people to be ensured. And in essence, we really think that the important part of the discussion at the moment that there hasn't been enough emphasis upon is really trying to build a future state view and how to progress to a recovery position. If we can give our people a sense of the journey and how to successfully negotiate the journey, we're going to mitigate a lot of the concerns that are currently dominating our community and our workplaces. Now, it's a very large group that we're working with today. We obviously have taken also a range of questions in the submission. We've got our team on board who's working alongside us to try and collate the questions that are coming through. We obviously are going to be limited into what questions that the panel can deal with, but we're very keen to try and take feedback as we go through the session and try and get to address the issues that arise. So our team will be trying to steward that process and lead the questions through. Also, they'll be trying to address and answer questions as the webinar progresses. So we really want to encourage people to try and contribute through the Q&A facility. What you will do by using that facility is that everyone participating within this webinar has visibility of that process, and so they can see your questions and the responses that are putting there, and we'll try and do our best to work through that as a process. Just as we move into this process, it's not the first time that we've struck a significant community or issue like this. We have had a range of different experiences in the past. There are similarities and there are obviously differences to COVID-19, but there have been a lot of lessons that can be taken from that process and thinking about how we navigate forward, and then also bringing in some of our current thinking around this. So we're going to try and do that today as we talk through this process. So our starting point is really going back to thinking about some key principles that we think will underpin a successful strategy to work through this program. And firstly, going back to the point where we need to recognise that our people are a solution to harness. It would be easy for them in the current circumstances to feel that the whole situation is out of their control and they can nearly feel as a victim of the situation and the circumstances and the decisions that have been made. So moving forward, the strategies that are really going to help us to succeed both at an organisational and community level is to ensure that we can tap in and engage people to be part of the decisions that are made and the solutions that have been made. Secondly, a principle is about thinking about how do we navigate and create successful solutions to these difficult circumstances. So let's try and focus on what works, not what fails, and where we can identify and share and learn from what's working, try and replicate and amplify that both at an organisational and community level. And thirdly, we really think there's a really important part that the ethical accountability at every level in this issue is important to engage. So this means that decisions that we make from a policy point of view, from an organisational point of view, from a transactional point of view in dealing with people and the impacts of those decisions, it's really important to engage the ethical decision-making framework and have everybody who's making decision contribute and be accountable for trying to navigate a successful way forward for this problem. Just in thinking about this process, we think there's some good lens that we've used in other contexts that are useful to test the ideas that we're making, that we're putting into place. What we're doing in the decisions that we apply should be focusing on what matters. You should be trying to have frameworks which are flexible and dynamic and have the ability for people to be flexible within those processes and come up with innovative and constructive solutions. Building everything that we do around a process that's founded on engagement and trust is going to be central to reducing the anxiety, and really trying to have a process where we build collaborative partnerships. And we've got all sorts of stakeholders in this place. We will have customers, we will have clients, we will have our people, we will have contractors, we will have permanent staff and casuals, and we will have regulators. And there's a range of things that we need to come at it from a collaborative point of view to ensure that we get the best result for everyone. And ultimately, we build simple solutions that help people to successfully navigate and be able to ensure the successful functioning of the organisation and the protection of the community and their well-being in an overall context. So as we go through this discussion today and all the interactions we had, we really feel that this issue of trust is central to our strategy and thinking. And it's, to some degree, the level of anxiety that we've got, that we're experiencing at the moment probably does derive from that there is a bit of distrust that's derived from the different messaging that's come out from a whole range of different areas in our community and our organisation. So to move forward successfully in this place, we really feel that building trust and engagement is critical to finding a path. So I'm now just going to hand over to Dr. Sue Irachi, who's just going to give a bit of scene setting and context about where this has come from and about COVID-19. So Sue, can I ask you to connect in, please?
Yep, thanks, Kelvin, and hello to everyone. Thank you to all the people for joining us. You can hear me clearly?
I can.
I just wanted to start with a little bit of context for people because there's so much conflicting information and so much panic that I thought it was worth giving people some rational background of, have we been here before and how is it different? So I guess most people here will remember the swine flu pandemic, which is actually 11 years ago now. And that was the first time that we did a lot of screening for the flu, and also the first time that we saw so much absenteeism over winter. Schools were half empty, a lot of people couldn't go to work. And then we actually saw that repeated in 2017. So it's worth remembering that over 1,000 people died from flu in 2017. That's only a short time ago. So what's different this time this new virus with a strange name is actually related to the viruses that cause both SARS and MERS in the past. So SIRS means severe emergency respiratory syndrome. And these are a group of viruses. They're called corona because of their shape, which I'll show you in a second. And they're new in that they've been in animals before, but they haven't been in humans before. So what's different about this year is the containment measures. Because we haven't got immunity in the community, what's as disruptive as the virus is the need to limit the spread. So if we go to the next slide, one thing I wanted to share with you is that in these new times, we already have new ways of operating. And this is a particularly interesting time for me because in the last couple of years, I've been working in emergency telemedicine. And you might think, how could you do emergency medical care without actually seeing the patient? Well, what I've learned in this time is that there are all sorts of ways of doing things that we never dreamt of before. So now I now see emergency patients via phone or Skype calls, just like this. I can assess and advise people and often do management at home by emailing or faxing prescriptions to pharmacies. I can send medical certificates. And so I've actually entered a workplace long before COVID came along where we see the new technology and new ways of doing things as positive and pragmatic. And when people used to say, well, how could you possibly do that? We've actually found safe and more efficient ways of doing things, which is something that we can share with people later on. So just to go to my last slide before we have further discussion, a bit more background about this year's virus. So let's bear in mind that we're talking about a new winter respiratory virus superimposed on the ones that we normally have. So because it's a new one with no community immunity, there's a flood of information and advice that's coming out. And in my community within medicine, the social media are absolutely flooded with updated advice. And in my community, we know where the reliable information is. So we're able to distinguish sources that are just false news from the real thing. And interestingly for me, this is a time of expanded use of telemedicine. And many of you will have heard that the Medicare schedule now allows GPs to charge for doing telephone consultation. So medicine's a bit different for us now because we're doing a lot of screening, and the screening involves exposure of healthcare workers to potentially infected people. We've got the impact of the isolation policies, and that's the major thing that Kelvin's already talked about that's affecting both the way we live and the way we work. And that runs into the preventive strategies that we have to live our lives a little bit differently at the moment and possibly do that in future. And just to let you know what it feels like within the healthcare community, there's a lot of planning at the moment for how we manage when our healthcare facilities become overloaded. And it's almost certain that that's going to happen. We're already looking at ways of redesigning the way the work is done and channeling people through the system a little bit differently. And that's all in the background of a very concerning picture emerging from Europe. So several times a day, people are discussing and sharing what the precedents are like and how we can react to all that sort of thing. So I might leave my presentation there, and obviously I can come back in as you need me.
Thanks, Sue. I'm just going to connect in with Rod, one of our team, for a moment, and just see, Rod, if you had any questions that have been tabled. that we could address just at this point in the presentation.
Yeah, thanks, Kelvin. Sue, we've got a question from Holly online. Yep. If a person contracts the virus at work and the workplace has to be evacuated, she's interested in how many hours before it's safe to reoccupy those premises.
Hi, Holly. Thanks for the question. That's unfortunately a question that doesn't have a single simple answer, and it relates to the exposure that worker had to the environment, what the facilities and fittings are like. So what we do know that we'll discuss a bit later is that the virus does persist in the environment and that surfaces are contaminated for a different length of time depending on how porous they are. So what will happen in that situation is that there will be direct advice that you'll be able to obtain from the healthcare system that will give you an answer.
So I might just segue across to Sophia Newton, who's our biomedical advisor in this space, because I think she's got a bit of an insight into that question as well.
Okay,
so,
good.
Sophia, please join us, and just keen just to add to Sue's answer.
Hi, yeah, so just basically supporting Sue's answer, it's too situation specific to give a one-size-fits-all answer that's appropriate. I think in terms of addressing some anxieties around that question, that there's perhaps a worry that you won't receive clear instruction, you won't know what to do, or you'll be instructed to return if it's unsafe. I think it's safe to say that's not going to happen. If you are evacuated and there is a confirmed case of coronavirus in your workplace, you will receive help and guidance in returning to work and keeping yourself safe.
Is there a point where people can go to actually get some advice in that space?
When there's a confirmed case, they'll notify the Department of Health and Human Services, at least in Victoria, who will then communicate with all close contacts in the workplace.
Great. Okay. So here we're going to now, Sophia's dealt with trying to answer some of the common questions, so I'm just going to hand over to you now for that discussion.
Yeah, so I'd like to answer some common questions that I've seen both myself personally and in some of your discussion points when you've registered for this session. And then I'd also like to address some myths that I've seen circulating. So a common query we're seeing are questions about when a vaccine will be available. Recently, it's been human testing has begun in America on a possible coronavirus vaccine. Even though that is exciting and that may make it seem as though a vaccine is imminent, we're looking at probably best case would be 12 to 18 months before there is a reliable vaccine widely available for public use. In terms of how long the virus is stable outside the body, a recent study was conducted in the US that has been pre-released, but it hasn't been peer-reviewed. It indicates that the virus can probably stay on hard surfaces like plastic and stainless steel, so maybe what you would encounter on public transport or in the workplace for 48 to 72 hours, and then on more porous surfaces like polystyrene and cardboard, you're looking at 24 hours, 37 hours. But just be mindful that we are in the midst of an emerging epidemic. We are getting new information all the time. And even though that sounds like it may be cause for alarm, what that means is if you're regularly cleaning your workplace, washing your hands and sanitizing, you'll be taking care of most, if not all, contact transmission. The virus is transmitted, I think, in three main ways. There's close contact, so being around the ill person is the way that you can get ill, through airborne droplets, and also, as I said, through touch transmission. Another question I've seen is when someone can return to work after they've recovered from coronavirus. Much like questions about when can you return to the workplace if someone else has been ill, it's very situationally dependent. So when someone recovers, they will be instructed by a health authority when it's safe for them to return to work. And from then you can assume that that person is as safe to be around as anybody else. You may have seen in the news that airports and entry and exit sites, some countries are testing passengers' temperatures and trying to do fever screening to work out whether or not someone is potentially contagious. And I've seen some people asking if that's worth doing at shift changes to see if your workers are potentially ill. Unfortunately, the evidence indicates that it's not really very effective. The issue with fever screening is that you are likely to miss people who are infected and could be contagious but are asymptomatic. So a study by the European Centre for Disease Control showed that with their modelling, about 75% of infected persons would be missed. And from there, I think that's a good way to move into addressing some common myths. I think that this is important both for all of us personally and as leaders within the workplace. One of the best things you can do to reduce anxiety and maintain well-being is to combat misinformation and make sure that you are doing what you can to make your employees feel safe and feel like they can trust what's going on. Something that's very common are the use of face masks. If you're healthy, the idea that you should wear a face mask if you are healthy in order to stay healthy. The reality is that if you're a healthy person, you would only need to wear a face mask while you're caring for a sick person. The CDC, no health body will recommend the use of a face mask by a healthy person, and there's some worries that it can actually increase your risk of infection as it leads to you touching your face more often. You should, however, if you are sick or worried you're sick, you can wear a face mask as they're very effective at reducing you spreading the illness to other people. Another unfortunate myth is worries that because this is a Chinese virus, perhaps Chinese people are more susceptible to coronavirus and they may need to be avoided, or it may be risky to do business with Chinese businesses. That is absolutely not true. There's no evidence that any ethnicity is more or less susceptible to the virus or more or less likely to be an asymptomatic carrier. And I think, again, in terms of managing anxiety and maintaining positive, helpful environments, that's important to reduce ostracization and reduce tension. We have myths about the pre-existing vaccines, such as the flu or pneumococcal vaccine, can help protect or partially protect against the virus. Again, that's not true. These vaccines will only protect you against diseases they are created to prevent. Then there are myths circulating around the idea that you can perhaps flush the virus out of your nose. Again, there's no evidence that rinsing your nose regularly with saline will prevent or reduce your chances of infection. There are concerns that perhaps after being quarantined or completing a period of self-isolation, a person may not be safe to return to work, or they could still be an asymptomatic carrier. Again, after completing quarantine or being released from isolation, an individual is as safe to be around as any other person. We are currently in a test shortage, which I know has caused a lot of anxiety within the community, and some fears that during a test shortage, there's no point seeking help, or there's no help available for you if you're worried that you may have the illness. I'd like to emphasize that that's really not true. If you become unwell, you can and should seek help. There should be a local relevant coronavirus hotline, or you can reach out over the phone to your healthcare provider for advice and guidance. A lot of questions around quarantine, the purpose of quarantine, if it is safer to isolate vulnerable people, or what the point of quarantine is if everyone's going to get ill. As Sue has said, the issue that we are anticipating is that the healthcare system will be overwhelmed, which means we can't provide care to enough people. So the purpose of quarantine is to reduce the rate of transmission, not to prevent everyone from becoming ill, but to prevent them from becoming ill at once. And then I'd like to address a variety of myths around home remedies and cures. Yep, there's some misinformation circulating around the idea that if you raise your body temperature by taking hot baths, drinking hot fluids, you can raise it to a point that you can kill the virus or weaken it. Again, that's not true, and it's a thought that at best it's ineffective to behave like that, and at worst you're putting yourself at risk, or you're running your body down by raising your body temperature to dangerous levels.
Thanks a lot, Sophia. We just want to touch now on thinking about the broader concepts moving forward. So we think it's really important in taking all of this information into place and thinking about the organisational construct. The organisations really need to have a much more rigorous approach and dynamic approach to the risk models that they apply. And the risk model really needs to have a view to the future state. And what we would recommend is that risk modelling needs to be dynamic. It needs to continually engage and respond to the new information and conditions that are occurring. You need to have a broad approach to it and think not just in the immediate context of, for example, dealing with control of the contagion and the limitation of that, but the broader impacts on the business and also some of the obligations they're going to be need. A lot of businesses will have to meet community guides to ensure that our overall community structure continues to function effectively, and that brings in specific challenges for those businesses, particularly public facing. It needs to be inclusive and consultative. You need to ensure that you embrace all stakeholders and make sure that you're having it apply through different lenses, thinking about the short term, the medium term and the long term. And by doing that, you're actually creating some certainty for the navigation to the future state. One of the things that we emphasise as being really important is the need to calibrate and validate the decision making by the organisation. This is going to become a lot more important at the end of this process. Once we've moved through successfully and got past the infectious transmission of this process, a lot of the decision making that we have now is going to have to be accounted for, and it's really important that we've been broad and thorough and can actually validate that decision making process. There's lots of resources out there. We'll talk a bit about that at the end of this discussion, but there's some excellent resources that can help in this process. So I'm going to now just click over to Mark. Mark, have we
Thanks,
got your
Kelvin. Yeah, thank you, Kelvin. I was just swapping back across. I think one of the big issues that people are framing up is this issue of wellbeing, and how do we define what wellbeing is and isn't, both for the individual and also for the organisation. So what's helpful is to actually look at where World Health would lead us into this area of actually thinking about a much more holistic picture, which is really around that of mental well-being, social well-being and physical well-being. And after this, I'm going to come back to Carrie from Clyde & Co, and she'll actually talk about some of the health and safety implications through a legal lens. But one of the things that's very important is that we actually help our people have a clarity around what is well-being about. And clearly, not one strategy or one technique will fit all sizes. And so what we're trying to do is get people to think about this from a point of view of both the physical, which is often the most obvious that we can observe, through to the mental state, which is less obvious. And it's important that we become much more curious about what's happening in terms of people's internal world and how they're actually managing those challenges, and how is that actually tapping into prior concerns and issues that people have. And then obviously, one of the things that's really, I think, paramount in this space is the social well-being. But with social isolation and distancing, this is quite a challenge, and I'll come back to it in a moment. So what I want to frame up, when we think about well-being, we're really trying to flourish in all three of those areas of well-being. Next slide, please. So we thought it might be helpful to think about some tips or some guidance as to how might you then actually help in a concrete way people's well-being. The first thing, and it's probably the most obvious, is ensuring that we have consistent and honest communication. And where something is not clear, it is much better to err on the side of caution and not communicate that particular message. And to really cut through the fiction to the key facts. And in that is to provide a level of honesty. And so where things are not clear is to be able to tell the organisation and the people who make up the organisation, that is something that we're still seeking to make sense of and to answer. And with that, one of the things we're really trying to encourage leaders to think through is this idea of embracing curiosity. And because we've not been here necessarily before, and Sue's helpfully framed up, yes, we've dealt with pandemics before, but there is something quite unique about COVID-19, is we need to be careful not to apply our fixed perceptional view to what's happening, and to really be inquisitive of how people are managing, both those who are actually doing the work and those who have been isolated because of illness. And in terms of that, what we're thinking is a really important thing is how do you think through then engaging people as a solution. So they in many ways hold the keys to not only the way forward now, but into the future. And so in order to do that, we need to create an environment where people can feel a sense of being valued and trusted. In doing all of that, one of the things we're also wanting to suggest to you, it's really important we actually encourage people to unplug from the constant noise, because in a sense, it can actually become an unhelpful distraction. I don't know about you, but I actually start my day logging into a number of social media feeds and getting a download. That's already framing up my perspective of the day, my thinking about COVID-19 and my own well-being. So I think as a leader, one of the things you can actually encourage people to do is actually to take a break and to unplug and not constantly listen to the next news update. And with that, we need to frame this as an area that we have not been before. And as leaders and professionals, we don't have all the answers. There's something refreshing in being vulnerable, because when we're actually vulnerable and say, I actually don't have all the answers, but we're here together to sort this out, it actually encourages people to step out and also be vulnerable themselves, step out of their own shadow and talk about their concerns. The next slide, please, Kelvin. So with that in mind, what we're wanting to encourage is the idea that we think about how do we develop virtual social connection. So yes, we do need to unplug, but how do we create internal processes which can actually drive well-being around social well-being? And I'll come to that in a moment, just to suggest one of many digital platforms that you could actually have a look at to help facilitate that. The other thing we know when there's uncertainty is what helps people when they have a clarity of purpose. And one of the considerations is not just a clarity of purpose for the organisation, but for your immediate team. And that sense of we have a goal and we're committed to making that happen. And in all the uncertainty, that will actually help frame up people's well-being by saying, we've got a team goal, I've got a purpose, I've got a role to play. Yes, there's uncertainty, but I can connect with people in my team to make that goal happen. The last two considerations we want you to maybe think about is in terms of painting a picture of the future state. We need people to know how to make that happen. So it's really important that we engage what that future state might look like with all its uncertainty. And with that, when we actually enact, and I know many organisations, because you've shared with your registration forms that you've already enacted your crisis management plans, we just need to make sure that in the front and centre of those plans, both in the short, medium and long term, are people's well-being. Because sometimes when we go into that crisis management, critical management phase, we can sometimes lose sight of our people in that response. And then the last thing we wanted to add is after all is said and done, it's really important that we actually don't overlook people's self-care. So I've mentioned this idea of social well-being and how we might enable it. And then the next slide, what you'll see, if you could please pass on the next slide, Kelvin. There's a very good digital app platform called BeIntent. It's designed to connect people around the three elements of personal, mental and social well-being. It's an interactive app. It has a very intelligent algorithm that actually selects the information that you need to know and helps drive that to you by way of invitation. It also allows you to engage in responding as a team to challenges around well-being. It uses in a very intelligent way gamification to make it inclusive for people. And it also provides an array of video content that actually addresses these very issues about well-being and dealing with uncertainty, and particularly a pandemic. The last slide I think is really important for you as leaders to be aware of in this particular platform is it actually provides a dashboard for leaders and managers in your organisation. So what it does, it actually removes anything that might be of confidential detail and allows you to track your capital of well-being in your team. And we see this as being absolutely mission critical given that we're no longer in an office most likely together. We can't bump into one another while having a cup of tea or coffee. There's not that water cooler conversation going on. So this provides you a really good tool for tracking how wellbeing is going within your team and across your organisation, while not compromising people's basic confidential detail. So we go to the next slide, please, Kelvin. I thought it might be helpful now to hand over to Carrie. Carrie, do you want to talk now a bit about some of the health and safety implications and considerations from a legal perspective? And then I'll hand back to you, Kelvin, and we might go to Rod for questions.
Thank you very much, Mark. Well, I guess a lot of questions are coming up around what are our legal obligations, what do we do, how do we respond to this pandemic? It's something we've never faced before to this extent, I think, in the workplace that we're at, although I do take on board the comments about the previous pandemics that we've faced, but I think there's certainly amongst a lot of workers a feeling that this is something new and it's something very, very challenging for them. From a legal perspective, I guess the good news for today is that our legal obligations are the same today as they have been yesterday. They are likely to be the same tomorrow, and they're likely to be the same for the foreseeable future. And really, when we're talking about the health and safety of our workers, those continue to be the key responsibilities and obligations of providing and maintaining a work environment without risks to health and safety. Yes, that may be slightly more challenging today than it was 2-3 months ago, but it's still the same obligations and it's still the same risk management and risk-based processes that you have to follow and go through. Again, it's finding and identifying how you can provide safe systems of work, how you can provide adequate facilities to your workers. And again, that's becoming a little bit more challenging these days as certain supplies become unavailable. I was seeing recently that with the rush for people to work from home, the latest thing to fly off the shelves is monitors and laptop computers. So it's not just toilet paper and things like that. So everyone is sort of identifying, well, look, yes, that is our obligation, but how do we do that? Again, there's obligations around providing information to your workers, and I think we've had a lot of helpful information from a lot of the other speakers today around where you can get that information, what you should do with it. And again, we have obligation to then work out how we provide that to our workers in terms of the instructions and the training that we're giving them about how to operate in the current climate. There's been a lot of discussion as well today, which has been really helpful about risk preventions, what the actual risks are, what we can do to stop it. And again, Mark's really helpfully touched on some of the other issues, I think, from a workplace perspective, and certainly in identifying some of the risks and hazards that often get overlooked, and it's things such as mental health, anxiety. One of the other issues with people starting to sort of go into a period of self-isolation that starts to come up as well is issues such as loneliness, which has not been sort of something that you would ordinarily consider as a risk in this concept. There's also a lot of mental health and pressures from people who are really, really concerned about potential financial hardships that they may be facing in the near future. There's a lot of uncertainty around, will my job still be there? What am I going to do? And it's all those sorts of concerns that are also making it fairly challenging. Another aspect to consider when you're looking at, well, look, how we identify the risks, what are they, is issues around victimisation. What do we do with employees who we say it is safe for them to return to work? We say it's safe for them to continue working, but they raise concerns with us in relation to potential risks to their health around COVID-19. You know, do we say to them, well, you have to continue working? How do we manage that in the workplace? And those are sort of all of the issues, I guess, that are sort of piling up and spinning around today that has been very challenging for a number of organisations to face. So I guess in the context of that, well, what can we really do? And again, it's the same process and procedure that we've been applying for the last few months that we need to continue with, and it's stopping and thinking. So we have to plan and think about, well, look, what's happening now? What do we need to respond to? And how do we best do that within the circumstances in which we operate? Before 2020, I don't think there'd been such a heightened look at business continuity overall. I don't think it was in the forefront of every business's plans and perhaps a priority, but following on from, you know, the year that we've had so far in Australia with bushfires, droughts, floods, and now the coronavirus, I think it is something that everyone's looking to, and it's really important to do that in the context of your health and safety and your employee obligations. So at this stage, everyone's sort of looking at prevention and preparedness, like what we can do and how we can do it. But it's also really important to look at the future and think about things like, what can we do in response and what can we do as part of that recovery? So it's also adapting yourselves and working out how you can apply those key work health and safety principles to provide and maintain a safe workplace, provide adequate facilities, and how you would go about doing that, thinking about people, not just your workers, but also clients, customers, anyone that you, contractors, that your business might come into contact with, and thinking about, well, look, these are our core services. This is what we are doing. This is how we are going to do it. And these are our risks and hazards, and this is how we're going to identify and respond to those. And I guess in saying that, I would echo very strongly what Mark has said earlier. The best way to do that is to provide a high level of consultation with our employees. That remains a key work health and safety obligation. It's also a key employment obligation that we have for a lot of our employees, particularly those who are covered by enterprise agreements and the modern award systems. So it's really engaging in those forums and speaking to the workers about what systems and procedures we're putting in place, what we're doing to protect them and their health and safety, as well as what we expect from them in terms of what they need to do to protect others' work and health and safety. Because again, it's not just the organisation that has those work health and safety obligations, it's every single worker who comes to work or who does perform any work, and they have similar obligations, and we really need to work together to identify what we are doing and how we're going to go about doing it. And I guess
Carrie,
I was just going to leave.
It's Rod here.
Yeah.
We've had a number of questions around workers' compensation, and if workers contract coronavirus at work, is that compensatable?
Look, I am not going to be able to answer that on this forum. Workers' compensation is not my particular area of expertise. I'm more focused, I guess, on the work health and safety, legal obligations and employment obligations. So I would have to take that one under advice. Thank you.
Okay.
But I'm more than happy to answer other questions that might arise, because I assume there will be some in this space.
At this stage, it seems like most people are asking the question around workers' compensation.
Workers' compensation.
Yeah, so we might keep moving on.
We'll take that question on advice and see following the session whether we can provide some further advice after we've got some other input. So we will take that one as a question on notice.
Can I just jump in for a second? It's Sue. One of the things to allay people's worries about being blamed for causing infection is that it's highly unlikely that you'll have direct evidence that you acquired an infection at the workplace. When there's a pandemic and the viruses are all around, it would be like saying, I'm absolutely sure that I didn't get the flu from anywhere other than my workplace. So although that's not a legal answer, people can be a bit reassured that it would be very difficult to provide evidence that they would only have got an infection from the workplace.
Thanks, Sue. Look, I'll take, so look, just summing up, particularly with Carrie's comments, the process and how we respond to this is really important. It goes back to our essential tenet. The more that you engage with people and partner them in the decision making, the more likely you're going to get the right outcome. If people are assured, they feel trusted, they feel involved, rather than decisions being made to them, and switching that round to engaging with them and partnering in that process, it's really going to mitigate some of these issues going forward. It's not a panacea, it's not going to fix all issues, but I think we can be in danger in these circumstances of being in the pressure cooker and not taking the time that we need to do with engagement, and particularly within the amount of remote work that's been done. It becomes an exercise that probably needs to be done more diligently than we would normally do within our normal working and office environments. So just to make that overall observation, I'm just going to touch back to Rod now, just to see whether there's any other questions that have come through, Rod, that would be relevant to any of the panel members.
Look, there's probably one, Kelvin, that's been mentioned a few times, and it'd be for Sue, I think, and it's around, if you catch the virus and recover, can you catch it again?
Okay, I saw that one come up in the comments. What we know from the other coronaviruses, and I'll go back to remind you that MERS in the Middle East and SARS in Southeast Asia were the same type of virus, the same family of virus. And the way that both of those outbreaks eventually burned out is that people do develop short-term immunity. Whether it's long-term or not, we don't know that much because they're still in recent history. But we also know that no process in human life is 100% reliable. So you could never say it's impossible to get it twice, because less than 100% of infected people will develop immunity. But the vast majority of people will develop at least short-term immunity, which is how outbreaks eventually stop, because enough people in the community become immune to stop the virus circulating. That may not last forever, but it certainly lasts long enough for things like SARS and MERS to burn out and not recur in the short term.
Thanks, Sue. I've got one more question which comes from Joe, and that's how would you go about getting a medical clearance for certificate for someone to return to work after they've had the virus?
People would have to interface with the healthcare system. So it could be their GP through telemedicine. It could be a telemedicine service. And they would need to comply with each state's guidelines. So I've shared on the chat a couple of links to state health department statements. And that's where it tells you how many days you need to be fever-free or symptom-free, or how many days from the onset. And then they can have their GP or telemedicine doctor certify that. And thankfully these days, all of that can be done electronically.
Thanks, Sue. Probably going to bring the webinar to a conclusion at this point. Just for the audience that we've got out there, following this discussion today, and particularly now that we've collected a lot of questions in this space, by the end of today, we will be out circulating to the participants in the webinar a COVID-19 portal with a range of resources and references. What we've seen out there is that there's a lot of material out there, but it hasn't been stewarded that well, or it's not specific enough, and it doesn't really frame it in the thinking that we need to think in terms of organisational risk management and decision making. So we're going to be working with a group of that's contributing to this panel. We'd be very happy to collaborate with anyone that's on this call to contribute to this resource and make it work. And we're also going to be working with the Australian Institute of Health and Safety to continue and provide dialogue and engagement in the community of safety professionals, and would encourage everyone, if you're not connected with the Institute, to take the option to connect with the Institute and be part of that professional discussion and engagement. I'd really like to thank the contribution of the time and resource and thinking that's gone in from our panel today. Really like to thank this really big group of professionals who are on the front line of doing this and trying to help our businesses. And really, we've got a critical role to play. We're really important out there as a group of people to actually help our organisations navigate this and help them do that successfully, but also to help our people navigate it successfully and not only prevent them from becoming ill through this process, but also enabling the reduction of their anxiety and trying to support their well-being and the journey through to a successful exit from this experience. So on that note, I'd really like to thank you. We will touch back and engage with the group and very happy to take any further questions or responses to this issue, and very happy to try and connect people together. So Mark, is there anything finally you'd like to add before we close?
No, I just want to thank people for giving up an hour this morning, because we realise that there are many things that are happening, and to invest in this is greatly appreciated. And in the spirit of collaboration, we will seek to respond to the many questions. There's been a number of great resources shared, Kelvin, in the chat and the question. We'll distribute that, as you've said, through the portal. And we'll also look, Kelvin, at seeing whether we can make the recording of the webinar available. A number of people have been asking whether that will be possible, and we will seek to make that happen.
Yeah, that's fine. This has been recorded and we will make it available through the portal. So thank you, everyone. We'll bring that to a close, and we hope that you're successful in your strategies, and that as a community, I'm sure that we will succeed to navigate this difficult time. Thank you.
Thank you.